Have you ever looked in the mirror and thought like, hey, my smile looks a little too gummy? Or maybe my teeth just look a little too short. There is something in dentistry where we do gum reshaping. Well, the proper term is called a gingivectomy. But before you go jumping into this, let's see if this is actually the right case for you. So this gum reshaping is exactly like it sounds. It's literally someone takes a laser or a scalpel and they kind of contour and shape your gums, and they usually make it a little bit shorter and end up showing more of your tooth structure. And this is most commonly done when someone has a gummy smile. So that basically means like anytime you smile, instead of seeing like all your teeth like you want to see, you end up seeing a lot of your gum tissue, and then you see your teeth at the bottom. But sometimes people have like uneven gums where when they smile, like one tooth looks a little bit longer than the other one. And that's usually because their gums are like uneven. Now, sometimes in other conditions, people have like a condition or like they took a certain medication, they have like really like hyper-inflamed gums that just started overgrowing. In those cases, it's a little bit different. But the best case to do is when you actually have that gummy smile, but not just that, when the actual teeth are covered by the gum tissue. So for example, sometimes people have shorter teeth, but it's not because of a gummy smile. It could be because they just grinded their teeth their whole life, and then they shaved down so much of their teeth, so now their teeth look like little nubs. In those cases, if you do like a gingivectomy and cut off some of the gums, you're actually going to get into the actual root structure of the tooth, and then it's not going to really look so good. When you actually have a gummy smile, it means that like a lot of your enamel or like the part of your tooth that should be shown is actually covered by the gums. And if you actually remove that and then make it look really nice, eventually it'll heal and then make your teeth actually look a lot better. Now, sometimes in certain cases, it might be better to get like orthodontics, like braces or Invisalign, instead of doing this gum reshaping. So for example, let's say your teeth look like a normal height, like you have like the enough visibility there of your tooth, but they're still like too low. Like you can still, still looks like a gummy smile. In those cases, if you cut off the gums, your teeth are gonna look extra long. That's gonna look kind of weird. So in a case like that, it would be better to actually do orthodontics. Like go to orthodontists and do like braces or Invisalign, and then they kind of bring those teeth up. Because if you actually move the teeth through the bone, whether you're bringing them out or bringing them in, when you do braces, the gums actually follow. It doesn't just like pull the tooth out of the bone. It actually brings the bone and the gums with it. And sometimes people combine doing like orthodontics, like braces and Invisalign, combined with a gingivectomy, like actually like shaping the gums. And sometimes there could be other reasons too. Like sometimes your teeth can look short, but it's actually because your teeth are like tilted, like one way or another, like they're kind of tilted in towards your tongue or tilted too far out. And in those cases, again, the gum really shaping won't really do a whole lot, and it might actually make things worse. So if you're interested in something like this, you can probably see that there's a bunch of different possibilities and outcomes. And that's because it's true. There's so many different scenarios and different treatment plans, and we cannot just always choose one that would work best for everybody. So this is really important to actually go to the dentist and kind of explore your options. And you might have to talk with like an orthodontist or someone called a periodontist and explore the different specialties and actually come up with a full treatment plan. If you do end up getting like this gum reshaping, just know that I know it sounds really scary, but it's usually like pretty quick and you're totally numb throughout the whole procedure, and the pain afterwards is usually pretty minimal. Nowadays, people use like lasers and different technology that actually improve the healing. People usually don't really have too many symptoms afterwards. I have seen some amazing like before and after cases where people end up just getting like a gum surgery and then all of a sudden their smile is popping. They look all like a brand new person. But sometimes, like I said, it's a little bit more than that, but there's usually a way around it. You might just need to take a little bit longer. If you get like braces or Invisalign, that might take a little bit longer before you get the results that you want. But doing something the quick way isn't always going to be the best option either. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you guys in the next video. If you've whitened your teeth before or ever wanted to whiten your teeth before, you've probably been told something like, don't drink coffee or soda for like 2 days afterwards. So what if I told you that that is a myth, and there are many more myths out there on teeth whitening? Today I'm going to go over some of the biggest teeth whitening myths out there that are going to cost you more money or might even be damaging your teeth. And I'm going to show you what actually works